Welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton, and I'm a maternity pediatric chiropractor as well as mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. This episode today is sponsored by Informed Pregnancy Plus, which is a fantastic streaming platform for pregnancy and parenting. You can experience it for free at informedpregnancy.tv. Today's episode focuses on the physical prep for pregnancy, birthing, and parenting with Anna Downs. For the past 12 years, Anna has been dedicated to empowering individuals by providing exercise education that not only boosts confidence, but also nourishes the body, preparing people for the physical demands of pregnancy, birth, and parenthood. What sets Anna apart is her deeply personal journey into this field. As an ex-British Army officer with service in Iraq and a former athlete in the Great Britain Division Squad's Biathlon, she understands the importance of physical fitness and resilience. However, it was her own traumatic deliveries resulting in life-changing injuries along with her battle against cervical cancer that ignited her determination to make a difference in the lives of others facing similar challenges. If you'd like to learn more about Anna, you can find her on all the socials at Move Well with Anna or at movewellwithanna.com. Hi, Anna. Welcome to the show. I'm very excited to have you on today.
I'm really excited to be here. Thanks for having me.
Yeah. So today's topic is physical prep for pregnancy, birthing, and parenting. I know this is a topic that you're very passionate about, and I'd love for you to share with the listeners a little bit about your personal story and kind of how you've become so passionate and an expert on the topic of preparing the body for pregnancy and birth.
Yeah, absolutely.
And beyond.
Yeah, no problem. I mean, I think like many people who find their life purpose, it comes from a deep need to kind of solve something for yourself. And mine was one of those typical stories. I was an officer in the British Army and I was an athlete, and I thought I understood my body really well. I thought I knew how to be fit, how to be strong, how to prepare for very specific physical challenges. But honestly, pregnancy just hit me like a truck. And I was also carrying a back injury at the time, and my world just fell apart. And it was such an unwelcome shock to the system. And I ended up gaining an enormous amount of weight, a huge separation in my tummy muscles, pelvic organ prolapse, a very difficult delivery first time round, which left me with some significant pelvic injuries. And then just like this hormonal shift afterwards, and just didn't really know how to fix myself, and nobody else could really give me the answers either, other than do some sit-ups. Don't worry, it's normal if you pee yourself after you've had a baby. All of that information. I mean, this was now 15 years ago, so I've I think things have changed since then, but
they've improved. Yes.
Yeah. But my
and this was in Great Britain when you gave birth?
Yeah, this is in England. I was living in the south of England at the time. And I just kind of then embarked on this mission of trying to heal myself. I was used to being incredibly fit and incredibly active, and suddenly I couldn't, walk more than a few steps without crippling back pain, feeling like my insides were falling out, and, peeing myself every time I laughed, coughed, or sneezed. And that just wasn't the me that I had, in store. I didn't want to be living my life like that. And to add on to that, the fact that you're then caring for a whole little human while trying to kind of figure out what the hell is going on, I was like, right, I'm going to sort this out. And so it led me down the path of doing my fitness qualifications. And then the more I dove into it, the more I realized that I was just scratching the surface, and I just kind of went down a rabbit hole of qualifications and knowledge and trying things out myself. And then that ultimately led me to start my first business in the UK, about 3 years after I'd given birth, just in a mission to kind of heal myself and then make sure that no one else was going through the same problems.
Right. And it is interesting, like exercises while you're pregnant and certainly postpartum are different than preconception woman, for example. And I think there's societal, at least in America, there's very much this push to get your body back after giving birth and really not being patient and kind to how much your body has gone through during the pregnancy and birth. And it needs to heal and recover and replenish. And then to your point, the sleep deprivation and the intensity of taking care of a newborn impacts our ability to move to a certain extent, right? So movement is important, but the right movement is really important as well.
Yeah, I get it. It's so, and there are so many myths and there's so many preconceptions, misconceptions about what we should and shouldn't be doing during pregnancy. And everybody wants a list, like a really firm list of you should do this, you should not do that. But it really is so tailored to the individual because it depends on what your lifestyle's like, how you're moving, what your genetic predispositions are and your posture. There isn't really any one size fits all, but there are general umbrellas that we can look at and make sure that we're addressing them and then trying to, unpick the puzzle. It's so complex. And I feel very aggrieved when we're presented with when you're pregnant, you need to do this, you need to sit and you need to do yogic breathing and maybe go for some gentle walks, because actually we now know that so many pregnancy related pain and discomfort comes from weakness. And so actually, if you're suffering from something like pelvic girdle pain, really training some of your glute muscles and addressing that can be absolutely life-changing. It can mean the difference between sitting in a wheelchair for 9 months and, being fit and active and then hitting the ground running after you give birth. It's there is so much that we can do, and the misconceptions are enormous still.
Yes. And every woman's body is different. And even every pregnancy, you've gone through 2 traumatic deliveries. And I'm sure you had different experiences with both pregnancies and both births, right? So like that's real as well. And I think, I see that in my practice even with breastfeeding, like women are like, oh, I breastfed my first baby, no problem. And now like, why can't I do it with the second? And it's like, because it's a different dyad, and that baby, even in utero, that fetus is a different baby than another pregnancy. So the whole, where you're at in your life and your age and your health and all the status that's going on with that, your lifestyle, all impacts that current experience. And we just have to be present. What does my body need right now? Not what did it need 6 months ago or 2 years ago or a year from now? Like, it's like, what does it need right now?
And I think those comparisons are so strong during that transition from not being a parent into parenthood, because we only have what we know our body, how we know our body to have behaved for the past, 20, 30 years previously. And suddenly we're trying to compare it and make that our bench point of, oh, but I'm not doing that anymore. I'm not moving how I did before pregnancy. I'm just like, you've just grown a whole human and you've exited out of your body. There is no way that we can expect ourselves to be unchanged by that experience, as wonderful and as, terrifying as that is.
Right. Yeah. There's a lot that our bodies go through physically, mentally, emotionally, spiritually in this perinatal journey. And I think that's also what makes it so powerful and all the beautiful things that also can come with these experiences. So for women listening that are like, I want to feel good during my pregnancy, I understand the importance of movement. How can a woman understand what exercises and movements are best for her, even from day to day during that pregnancy or day to day after birth, right? Like that even can change moment to moment. So how can that woman be maybe more intuitive or more in touch with what her body's needs are?
I think having an understanding of how your body is physiologically changing, not just, the lovely apps you get where it shows you your baby's like a peanut and then like a grape and a melon. I mean, that's wonderful, but that's very much focusing on what's happening with your baby. If you, as a person who's growing a baby inside you, understand how that is changing your posture, which muscles have got more length, which muscles are being compacted, then you can kind of have a really intelligent approach to how you're going to exercise and move during your pregnancy. I mean, for example, this is a generalization, but most people during pregnancy, their pelvis will tilt forward excessively. It creates a big curve in the lumbar spine, and that can create a lot of tension down in the sacrum and in the lower back. If we look at the muscles that are attaching into the pelvis from above and coming out of the pelvis below, then we know that if we want to mitigate some of that, the excess of that forward tilt of the pelvis, we need to strengthen our bum muscles, and we need to release our hip flexor muscles around the front of the pelvis, and we need to make sure we continue to mobilize and keep our back moving, keep some twisting in there, which up until a few years ago was a massive no-no, but now we know that it helps you to move freely. And so, if you're finding that very overwhelming to kind of look into what's happening in your posture and get a little bit technical and medical, then find yourself a trainer, hunt around, find someone you've got chemistry with that you really trust, that's going to let you ask those questions and not be defensive about it. And if they don't know, be willing to go on that learning journey with you, because it is a field that is evolving by the month, and we're getting more and more information, more and more studies are coming to fruition. And we just need to find somebody that you really trust who can guide you through that and isn't putting restrictions on what you're doing. They're asking questions. So instead of going, no, in pregnancy, you should not get hot, you should not lift your hands above your head, you should not do this, they go, okay, so what are our boundaries here? What is our goal? We ultimately want you to be fit, strong, and feel empowered. And so that needs to be the driving force behind any exercise program in your pregnancy.
That's right. And then you can, especially with the guidance of a trainer who's helping to keep you safe and prevent injury, you see what really feels good, right? And then if something isn't really feeling good, you communicate that. It's an open dialogue about what's feeling good for your body. If it's a day that you're feeling a little tired, then you do more of a gentle, restorative yoga type practice. And if it's a day that you have a little more pep in your engine, then give it, perhaps second trimester is where typically the most pep exists. And I think that's important. And that can even change from, day to day, week to week. You were mentioning a lot about the anterior pelvic tilt and changes in the sacrum, especially, which is where the uterus attaches, and that impacts baby's position during the third trimester and can directly impact the type of birth a woman has, or whether she has the option to have a vaginal delivery versus a cesarean if it's a breech or transverse position baby. As a chiropractor that's Webster certified, I'm very passionate about the alignment of the pelvis, the bony pelvis, and, optimizing the birth canal, which is the bony pelvis, and then the fetal position for an easier labor and delivery. So I'm assuming, you were mentioning back pain. Did you get chiropractic care during your pregnancy, either one?
No,
postpartum?
I did everything wrong. I'm the poster child for everything you should not have done. I just kept my army mentality.
Just didn't know what was even available.
Yeah, the only people that were helping me out were men. And they were not bad. They were not ill-intentioned. They just didn't know. They just didn't have the knowledge. And
you didn't get the referral. And that is challenging. If someone's working with an obstetrician and they're not knowledgeable about referring for physical therapy, chiropractic, massage, acupuncture, all these things that are very safe during pregnancy, working with a practitioner who specializes in that population, you can get a lot of pain relief with back pain, right? And, sometimes the response could be well, after you give birth, your pain will go away. So just hang it out for another couple of months. That's not the answer, right? There's a lot you could do to act. And the obstetrician is not the person to do your chiropractic and your PT and your massage, right? That's a different practitioner. And that's why I'm so passionate about a birth team, right? The birth provider is only one part and one piece of your pregnancy and birth delivery.
Yeah, I 100% agree. I think that, it really does take a village. It's not just a saying, it is a mentality that we need to keep in mind when we're going through our pregnancy, because no one speciality is going to have all the answers to all your problems or
right.
your concerns.
It's so true.
Yeah, I mean, I currently live and work in Bangkok, and I feel that the approach to birth in the private medical system is very different to how it was when I was in Europe. It is very hierarchical, and the OBGYN is, their word is God, and there isn't a lot of open referrals to other practitioners. I mean, it's a society where they don't even have midwives. You have the OBGYN and then maternity nurses. And so trying to gently nudge and massage the option of there being other ways in which we can support people who are in pain and discomfort during their pregnancy and early postpartum it's been an interesting challenge for the past few years. But
yeah, I was going to, you make an interesting point. You've lived in two different countries, both not the US, which is where a lot of my listeners are located. And, the US has a long ways to go, in my opinion, in improving maternal and fetal outcomes and really supporting pregnant and new moms, right? But that challenge can exist in other countries, and it looks a little bit different as well. I would say, the countries that have more midwives are certainly having better birth outcomes. And, you even raised an interesting point, because pelvic PT, which can be done during pregnancy and after giving birth, which is amazing for helping to support those pelvic floor muscles and the abdominal, the core muscles, the transverse, and really the posture, everything that's related to holding our skeletal system up, as well as supporting the pelvic organs so they're not falling out of our body, like you mentioned. That's very, from what I'm hearing, it's very common in France, for example, right? Like every woman who gives birth is seen by a pelvic PT and checked to see if there's tight muscles, there's weak muscles, where's their imbalances, and helping them essentially heal much faster after giving birth, no matter what type of birth they have. And that's becoming a little more popular in the US, but at the end of the day, it's certainly not mainstream at this point. And you're saying it wasn't really, I guess, mainstream in England either, even though that's not like...
I think I'll be honest, I'm a little bit out of date for what's current in England. I haven't lived in the UK now for 8.5 years. So
right.
I know that it is a growing practice, but here in Bangkok, pelvic health physiotherapy isn't a practice. There is no such thing.
Wow.
I have now found one therapist in Bangkok, but they don't do manual therapy. It's all instrument led. So it's we're changing and developing, but we're having to push quite hard from the bottom up.
Right. So it's recognizing like what's available in your community. Certainly in the bigger cities in the US, you can get your midwife, you can have your whole birth team, your doula, your chiropractor. There's the whole team available to you in that perinatal field. And I would say, like, women coming to my practice, I can refer them and direct them around a lot if they're not able to get that referral from their birth provider, right? Like their birth provider may not have that list. So finding somebody else in the community, maybe somebody that your sister or girlfriend had used for their pregnancy and birth, can be a great referral, and they're local, right? Because a lot of these practitioners ideally are local. Do you work with women living outside of Bangkok?
I do. A few. I have a few that were based in Bangkok pre-COVID and then have moved elsewhere in Asia where there is no provision. So I have a few clients in China and Vietnam and Myanmar, but most of my clients are now in Bangkok.
Mm-hmm. And so it's just interesting, like you're really almost in some ways their physical therapist and even not chiropractor, but you're doing the body work to help really support them in feeling better, right? From a pain-free perspective. And we know that when the body is feeling good during the pregnancy, birth outcomes are optimized, right? Anyone who's having pain and symptoms, common pregnancy symptoms, can have potentially more challenges with the birth and certainly even postpartum recovery. So it's the body's red flags, right? Saying, I need help, I need assistance.
Yeah, absolutely. No, it's been a real privilege to work here. And when I first started, I think my work was much more traditional personal trainer, strength and conditioning and fitness. And I've very much kind of whittled it down into the place where there hasn't been anyone providing this. And it's much more remedial and dealing with this kind of the smaller nuances of transverse abdominal activation over activation of the obliques, which as a regular PT, I just wasn't really tuned into. It wasn't really part of what we were looking at, but it's been such a privilege being here for this awakening, because there are now more people doing their qualifications and learning more. And we're getting a really lovely community working here, supporting the expat and branching more into the local community as well. It's great.
That is amazing. And you mentioned a good point with the core and the abdominal wall. Like, I've gone through the Tupler technique training. I don't know if you're familiar with that, but that is all about really healing diastasis recti, or separation of the abdominal muscles. And I would say, a lot of personal trainers aren't aware that like crunches, sit-ups, these are things that are the worst thing to do, even if you're not pregnant or postpartum. But certainly that body that's more prone to ligament laxity and stretching does not want to do something that's going to create intra-abdominal pressure against that weak connective tissue, causing more of a separation in the abdominal wall. And there's women certainly entering pregnancy with that separation because they were a gymnast or a dancer. And now the pregnancy and working out postpartum to get their abs back make it worse, right? So they're actually doing activity to help heal their core and help get their waistline back, right? And they're actually aggravating it. So what are you doing with these women to help literally heal that separation?
I think awareness is the number one thing, awareness and education, because if you don't know it exists, then you're just looking down at your tummy going, oh my God, I just still look pregnant. I had my baby 5 months ago. Why have I still got this pooch? Why every time do I have gas? Does my tummy pop out? And I think as soon as people know that if you have a weakness in the abdominal wall and you're not activating those muscles correctly, or the coordination between your diaphragm and your pelvic floor is out of whack, then we can kind of unpick the puzzle and we can figure out what's going on and we can make a treatment plan. We've been providing a free clinic each month here in Bangkok for people to come and get their tummies checked. And it's created this amazing ripple of awareness, and people are really talking about it and trying to figure out what to do. And it's been so lovely watching the conversation start in all the mummy groups about, oh, you might have this if you tried doing that. Oh, don't do crunches. Maybe don't do that. Oh, go and try this. And yeah, I think the awareness and the education is the primary thing. And then we look at, what's going on with your individual body. And I will always assess breathing function to see if what's happening with your ribs, whether they're just stuck. We'll check transverse abdominal activation, and then we do a verbal screening for pelvic floor dysfunction. And all of those things help us to come up with pretty broad spectrum, but effective treatment plans. And then if I can, we'll refer on to a physiotherapist if we can. But there is, we're still waiting on a few more people to get their qualifications. But we've got a few lovely physiotherapy centres here who are now wanting to work with us, and they're seeing the progress that we're making. So we're now sending their trainers abroad to get their qualifications, which is so exciting.
That is exciting.
Really exciting.
I mean, I have to say, it makes me feel like grateful for the resources that we have in America, right? Because I'm like, oh, there's so many women that are suffering, but yet at least the resources are available. So that's why I have this podcast, is at least to get in front of people and be like, you could, this person's in your community, right? Like, you just have to know to call them and reach out. And I do think the Facebook momming groups have really shifted a lot of that, because, I opened my practice 20 years ago. There was no Facebook. There wasn't this type of way for women to really connect within their community, right? They all live local, but they don't all maybe personally know each other. And now there's this huge resource for women to share with each other. And that's what women are so good at doing, is sharing and connecting. And if they've gone through a personal experience that was beneficial to them, they want other women to know about it. This episode is brought to you by Informed Pregnancy Plus, the ultimate streaming platform for expectant and new parents. Dive into a rich collection of insightful videos from iconic films from Ricky Lake's The Business of Being Born to The Empowering Orgasmic Birth and many others, including my documentary. Explore the mind-body section with meditation, yoga, and fitness classes, including Baby by Simone and Belly Dance for Birth, all with your subscription. Delve into workshops, book insights, and TV-style series covering everything from fertility to breastfeeding. It's a must-have for moms-to-be and birthing professionals. And with apps available for Apple, Android, and Roku, streaming is a breeze. The best part? Try Informed Pregnancy Plus for free. Visit informedpregnancy.tv and start today. I love that you talk about how exercise and being physically fit and strong is impacting confidence. And I'd love for you to speak a little bit about that, especially during pregnancy and postpartum.
God, it's such a massive topic. I think you go through so many changes, emotional, physical, hormonal, postural, so many changes in pregnancy. And it's very easy to lose a sense of self in every way. And I know you've done previous episodes talking about this, but I think one of the things that I love most about exercise is it can be so unbelievably empowering, but with multiple shoots of benefits that come out from that. I currently am running a prenatal fitness and education program, and we're doing it in a functional movement gym. And all three ladies that are working with me at the moment, none of them have really worked out before. They've, done a bit of Zumba or, 10, 15 years ago, might have been a member in a gym and sat and done a leg press machine. And we've got them now, deadlifting with weight or, doing lateral lunges with a sandbag. And they're just like, I never knew I could do this when I was pregnant. And I also didn't know that my body could do this. And they always leave just feeling they're buzzing. They're so empowered. And the thing that they love is just like, oh my God, I know that now whatever happens, I'm going to get through delivery because I know it's an athletic event. Whether you have a vaginal delivery or a C-section, it's still a really athletic event. It requires a lot of stamina. and they were just like, no, I've got this. I'm doing things I never knew I could do, especially in pregnancy. And I just feel like a superhero. And I just think that if you know that your body can do these things, then you're already winning. You can approach everything with so much more confidence. And when you do get the knockbacks, you're that bit more resilient. You have that little bit more in the tank to be able to cope with the things that aren't going well because, you're fitter, you're stronger, you have trust in your body. And I think that's so important when it's changing so much.
Yeah, that state of mind is so important. And especially as a woman's entering that marathon of birth, that belief in your body, that trust, that connection, I can do this. Because it's intense, right? Birth can be a very intense process. And the more you're mentally fit, which I believe is very much connected to the physical fitness, the more that you're able to really come out and feeling empowered on the other end of that birth and creating really an empowered motherhood. And the other thing I see a lot with my practice is that women that are doing strength training during their pregnancy and especially like working, the lower body's great for the birth itself, right? The squats, the lunges, all that. But the upper body is really important too. Number one, we don't want to be all rounded over from that weight of the pregnancy and breasts, right? Everything. But what about when we have to care for this newborn? I have women that are like, I can't hardly lift my 8-pound baby, right? Like, this is not good.
I know. And I'm actually giving a talk at a public health conference next month about this whole subject with, especially with C-sections and the disparity between the advice and the care plan given to someone who's having a major abdominal surgery compared to someone who's having major abdominal surgery, which is a C-section. You would never tell someone who's just had open surgery in their abdomen 2 days later to be picking up something that's 4 or 5 kilos and not putting it down for the next 4 months. You would you would, there would be a staged return to fitness, and you can't tell a new mum that they can't hold their baby, that they can't nurse their baby. We need to just find ways to support them through this process, and also address, the fact that this is really hard, and try and encourage that talk with our partners, with our support system, that, just because a C-section is common doesn't mean that it's any less major surgery. And how we can support, because like you say, having upper body strength is super important before you head into that operation.
Right. And into motherhood, right? No matter what type of birth you have, being able to hold the baby without having, numbness in your hands and chronic neck pain and referral headaches and all of the things that are coming from this posture of being rounded and really weak, right? Having weak upper back muscles, things like that. These are all things that we can address. And ideally it's done before the birth and before the baby is in our hands. So can you talk a little bit about C-section recovery? Because certainly it is a different recovery than a vaginal delivery for a mom to kind of heal that abdominal incision and the diastasis that probably came with it, and potentially some pelvic, trauma. You didn't even talk about your second delivery either. I don't know if it was vaginal or cesarean, or if you want to go there.
They were both vaginal. I mean, my first I was having a home birth, and it all went a bit wrong. My son was back to back, and brow presentation, ended up getting stuck, getting distressed. I ended up with a Keelan's forceps delivery, which is the forceps. They don't just come in, grab the baby and come out. They go in, they twist, rotate, and then they pull out. So there's a lot of damage to the perineal tissues, and it was a big mess. But second time round, much easier delivery, much faster. But I had placenta previa and ended up having a rather large bleed, and it was all a bit touch and go for a while, but we lived to tell the tale, and I have two gorgeous, beautiful children. And I'm always aware that, when you're telling your birth stories, it can be traumatic for other people who are trying to figure out their journey. And I don't feel bad about my deliveries. I just am very aware that if I'd had a little bit more knowledge and I'd been a bit more prepared, I think I would have been able to manage and deal with how I felt about it a bit better. I kind of went in a bit blind. I'd done birth preparation where I was told that I would blossom and bloom like a flower coming into bloom, and that really wasn't the case. And I don't want you don't want to traumatize people or make them feel nervous, but also there is a certain reality that needs to be addressed. Otherwise, when it doesn't go like that, it can then cause a lot of trauma and be hard to reconcile with.
Like a PTSD, in other words. Yeah. It makes a lot of sense.
I don't know whether you find that with, I don't know, there was a birth education system in the UK called the National Childbirth Trust, and they would run classes that would kind of prepare you for your, for birth and for baby. But it was, and it is amazing, but it is quite holistic in its outlook, and there wasn't a lot of emphasis placed on what would happen, what would it look like if you did end up needing an episiotomy or intervention or a C-section. And I speak to my friends who are all on the same course, and the level of, trauma, post-birth trauma from people who just went into situations they weren't expecting was much higher than when I've spoken to people whose birth preparation was a little bit more medical, I suppose.
It's an interesting fine line there, because it's also like that pregnant mind. We want to, like you said, stay positive. We want to visualize the birth we want to have. And there's things out of our control. That's the reality. As much as we prepare for a beautiful, holistic home birth, it's not always possible, right? And so I think just, accepting that and coming to peace with that is so important for a woman's mental health, and even helping to prevent, postpartum depression and other types of mental health issues.
I think that's where having a doula is such a powerful a powerful tool in your birth. Having someone there who can just advocate for you, who can make things, pause things, stop, ask questions, really explain it to you. I feel like everyone should have a doula. I feel like
everyone should have a doula. Yeah. I'm highly on board with that one. Yeah. They are such a beautiful advocate. And I think the advocacy comes like, once again, you can have a little brief knowledge, I would say, about like interventions and what would happen during the pregnancy without putting a lot of focus on it. But once you're in that labor and you're like minute to minute, this is actually what's happening. That's where, and the decisions have to be made. We want to be making those decisions out of education and not fear, right? And it can be very scary, and potentially the birth provider can also be putting some pressure towards what their tendencies or preferences are. And you want somebody who's neutral and who's like, really like, you can, it's your decision, right? And whatever decision you make is the right one for you and your baby. And trusting that, right? Really trusting, even if you're getting pressure from outside to make a different choice.
Yes, no, I totally agree. I would have loved to have had a doula.
You didn't have a doula for either birth?
No. As I said, I did everything wrong.
Oh man. So I'm actually going to follow up with the question I asked originally that we got sidetracked, but because I asked the second question right away. So a woman who's had a C-section and is now looking to recover physically from that C-section. I know everyone's a little bit different, but do you have some general guidelines that can help us support a woman post-cesarean?
Yes, I very much advocate for the use of medical grade compression in those first 6 to 8 weeks.
Like a belly binding.
Yes, but but carefully researched and selected, because if belly binding is done incorrectly, then it actually creates a lot of downward pressure through the pelvic floor and restricts your diaphragm movements. So we're looking for that. I mean, there are several companies that have post-surgical, post-C-section compression garments that just give a little bit of perineal support and a little bit of support around the incision, and it just takes some of that fear of movement away and allows you to handle a child, handle a baby without so much fear and discomfort. So that would be my first tip for the first 6 to 8 weeks. The second tip would be to start your core synergy and intra-abdominal pressure training almost from day one. So that can be as simple as making sure that when you're picking up your baby, or you're moving from sitting to standing, or you're picking something up, you're just going to breathe out and gently focus on drawing the anus up towards the belly button. So a small pelvic floor contraction as you're exhaling. And that can be just the kind of the focus that you need to make sure you're not holding your breath when you're concentrating or when you're feeling scared. Because when you hold your breath, you have outward pressure, especially when you're moving, because that's when you create the intra-abdominal pressure. So we want to be supporting and getting our internal corsetry working and activating from literally day one. As soon as your catheter is removed, I would be advocating for an exhale with a gentle pelvic floor lift on exertion.
And I would say that probably takes some practice, because that's probably not how most people typically breathe or move. So you really have to be conscious of that. But what you're talking about is not only activating the pelvic floor, but also that transverse muscle, right? Which is really what you want to be activating with those change in position. Like you mentioned, getting out of bed, rolling to your side, right? To push yourself to seated, to then go to standing. And then also perhaps having a pillow, holding a pillow against your lower abdomen with those positional changes to help protect that incision. The first couple weeks. Yeah.
And the third thing that I would always say is to immediately start thinking about your stacking. So imagining the ring around your ribs where your bra strap goes, and making sure that's horizontal to the ring of the top of your knickers, your underwear. So you have a stacking between the ribs and the pelvis, because then you're aligning your abdominal muscles in a way that's not creating excess strain and stress through that healing tissue. And you can you could think about being in that position when you're sitting, when you're lying down, when you're standing, and especially important when you're holding your baby, because we tend to then push one hip out and push it forward. And, that incision doesn't fully heal for about 2 weeks, but you're already having to move, you're already having to lift, you're already having to twist, and you're holding weight all the time. And you wouldn't be in a circumstance after abdominal surgery where you're carrying a kettlebell around 24/7 without some sort of support and help. So awareness of how you're breathing, what your posture's like, and then that compression, and whether that be through a garment or, like you say, putting a pillow over your tummy when you're about to cough, when you're about to move or sneeze, is so supportive and welcoming to the body.
Yeah, it's just really taking that extra pressure and tension off of the incision that's still healing, and not just the external one we can see, right? But all the incisions underneath it with all those layers of tissue that are also still healing post-cesarean. I love your idea of helping a woman imagine the stacking, because guess what else is getting stacked? The spine, right? If the muscles of the core and abdomen are stacked, the spine is going to be in a better alignment. The nervous system is going to be activated more. And what I tell women that are holding a newborn and especially breastfeeding, it's about bringing the baby to your breast, not your breast to the baby, right? So we're in a position, the gliders that recline are great for breastfeeding, especially after a birth, because you can kind of lean back, and that also helps, especially a tiny little baby, right? There's not a lot of weight there, but we want to get them up onto the chest and latched for feeding so that you're not hunched over. And I know a lot of women that are having challenges with getting a good latch are so stressed, they're all leaned over, and it creates just a lot of tension in that upper back and neck because of that. So the more we can just be open and supported and having pillows and other props, breastfeeding pillows, things like that, the better alignment for baby and mom during feeding.
Yes, totally agree with that. I think the other thing that I really love to put emphasis on is just how you're breathing, really noticing what's happening. Is your rib cage moving? Because so often after pregnancy, when you've had everything kind of shoved up into the rib cage, we get that rib flare, and teamed with the oblique muscles being overstretched and the abdominal muscles being overstretched, they just kind of stay there. And if we're not letting our rib cage expand and contract with our breathing, then we're also not stimulating our parasympathetic nervous system, which is so needed in those first few weeks and months when you're sleep deprived and you're in a hormonal desert. We need to breathe, and we need to notice how that's feeling in our body. And even if all you've done throughout the day is been to the bathroom, fed your baby, had a lukewarm cup of tea, if you've sat and you've breathed every time you're feeding your baby, and you've just focused on how that's feeling in your body, that's so unbelievably restorative. And there is no race. We don't need to race in this postpartum period. We just need to reconfigure, reevaluate, and just ease our way into this next chapter.
Yes, there is definitely no race, and there's also no competition. Like, what is my friend or girlfriend doing? Their baby's the same age. We just have to get rid of any of those expectations for our baby and for ourselves, right? And I think what I loved about the breathing that you mentioned is that's meditative, and that's really helping to ground that woman in this present moment right now. I might look a little messy and maybe my hair is a little dirty, but I am breastfeeding my baby. I'm holding my baby skin to skin, tummy time. And how magical is this? I created this baby and birthed this baby. And I feel like that is so important for that connection, that bonding also, right? The emotional bonding that's occurring. The baby's getting their microbiome is developing with that skin on skin time with mom or dad. And I just, they're so beautiful. And it's very finite too. Like I have a 6-year-old, you have older children, those first few months are a little crazy and intense, but they're also like so precious. And the more we can really treasure it at the moment, it's just so magical.
Yeah, I mean, I'll be totally honest that my kids are now 15 and 12. And if they ever get that rare moment where they nestle in for a hug, it's exactly the same feeling. It's like a imprinted memory. The hormones all rush back. I just want to gobble them up. It's, and that definitely comes from those hours spent just holding and nursing and comforting. It doesn't go.
It's so beautiful. And it's really beautiful, really, for both parents, even, dads that can do that skin on skin. It's so wonderful for the babies, flora, their skin flora, their gut flora, and the health and development of their digestive tract and their immune system and all the things that come from that. So, and then also really like studies showing how that can help with postpartum depression and anxiety, because that's really being out of the present moment, right? If we're feeling those, there's the hormonal component, but if we're really just connecting to this baby and know that the baby's safe and we're safe, and we're not in this sympathetic state, right, of fight or flight and fear, then we can really I feel like that helps with that hormonal desert you mentioned, and helps with our emotional state and what's needed and required to get through the intensity of that, fourth trimester.
Yeah, totally agree. We would all just benefit from slowing down and breathing and just more present.
And that's good advice, honestly, even beyond the fourth trimester, for all of us as moms. Like, it's not a race ever, right? So, and there's times to move a little faster than others, but if we're feeling overwhelmed and crazed, then we just go back to the breath. We go back to that stillness, that mindfulness, and that connection with our child, and get into that parasympathetic, which is what you were sharing. And life is a lot better from that state than from the fight or flight.
Yeah. And I think our privilege as people, body workers, is that we need to find the language in which to communicate that, because some people will really connect with the more holistic approach to it. So, talking about being present and breathing, but other people who are not of that way of thinking, we need to then just go, okay, but you're going to benefit from this. I can't talk to you about, being mindful and being present. So now we need to go, okay, I want you to sit there and I want you to breathe in for the count of 4, hold for the count of 4, breathe out for the count of 4. And I find that a lot with a lot of my military friends. They don't want to be, thinking about yoga and humming. They want to be, have practical tips. And so it's translating the same methodology into different language for different people, because it's got to fit everybody in their own way. Otherwise it won't resonate and connect with them.
It's so true. And what we're talking about is a conscious breathing. And to your point, you can communicate that different ways, but all of the women, and including, older moms, right, are all going to benefit from having that breath. And we can model that for our children, right? And we can show our children that this is how we breathe and this is how we, get out of that oversympathetic fight or flight state, which will also benefit the next generation as well. Well, Anna, this has been amazing. Do you have any last thoughts you want to share with the audience?
No, I think the only thing that I would say from, my experience as a mum myself and from working with like over 1,000 women in the past 12 years is just to be kind to yourself, because so much is changing, will change, and will be forever different. And it's just having some self-compassion and some self-grace and just, being kind to yourself, and not just, taking that time to acknowledge the amazing thing that's just happened. You've grown and birthed and bringing up a new human into the world. And that is amazing. And just having that grace to acknowledge that for yourself.
So beautiful. Anna, thank you so much for coming on the show today.
Thank you.
Well, I hope you enjoyed today's episode. It was really a pleasure interviewing Anna and having her share really her raw, authentic truth around her own traumatic birth experiences, because she felt uninformed and unsupported during the perinatal phase of her life. And I think what's important is with pregnant women, we want to focus on positive birth stories. However, there is lessons to be learned from women when their stories are not positive. And I think she really laid it out in a very eloquent and empowering way so that women listening can learn from what her experiences were. And then also really how important their exercise is for our health as women, as pregnant women, and as moms, and how that exercise can really transform how we feel about ourselves, self-love, our confidence by nourishing our body and really setting us up for success with all of the intensity that comes with pregnancy and motherhood.